Alzheimer's is a disorder which is progressive in nature and is neurodegenerative. It usually impacts people who are 65 plus, but can also impact people lower than age group. It gradually damages brain cells and leads to decline in memory, thinking, behavior, and the ability to perform daily activities. It basically happens due to disruption of communication among brain cells, which trigger inflammation, interference with the transport of nutrients and essential substances within the nerve cells of the brain, progressive death of neurons, which impact the memory and cognition, neurotransmitter deficiency, where the reduced level of neurotransmitters impact learning and memory of the patient, shrinkage of brain tissue. No exact cause have been found for Alzheimer's, but there are several factors which increase the risk, which can be categorized into two. There are non modifiable risk factors and modifiable risk factors. So, first, the non modifiable risk factors are increasing age, that is old age, family history of Alzheimer's disease, that is your hereditary. Then there can be genetic mutations. Usually, females suffer more from Alzheimer's, and in case of Down syndrome, also there are higher risk of Alzheimer's disease. Then comes the modifiable risk factors, which can be hypertension, diabetes, obesity, smoking, excessive alcohol consumption, physical inactivity, that is following a sedentary lifestyle, poor diet, chronic stress, which is a stress which is taken for a long time of period, depression, sleep disorders, or any kind of traumatic brain injury. The symptoms of Alzheimer's disease can be divided into stages. In the early stage, a person experiences forgetfulness, difficulty in remembering recent events. Usually, they misplace objects, they keep objects somewhere and are not able to remember where they kept them. Trouble finding words, mild difficulty with planning and organization of various things. The next is the moderate stage where they experience increased memory loss. They feel confusion about the time and place. They have difficulty recognizing familiar people whom they haven't met for a long period of time. They experience mood swings and behavioral changes. Then they have difficulty performing daily tasks, and also they face problem with judgment. Then next comes the severe stage where they have problem in communicating effectively. There is total inability, loss of recognition of family members. So maybe if somebody who's staying with them every day, they remember them, but otherwise they cannot remember family members. Complete dependence on caregivers. Many times, even for eating food, they are dependent on their caregivers. Difficulty swallowing, loss of mobility, and severe cognitive impairment. There is exactly no treatment available for Alzheimer's disease, but the treatments that are available can help to slow the symptom progression and improve the quality of life. So, first, there are pharmacological treatments to improve memory and cognitive functions. Then there are the non-pharmacological treatments, which includes memory training, occupational therapy, cognitive stimulation therapy, physical exercise, social engagement, and nutritional support. That is having the right kind of diet so that when your gut remains clean and active, it also activates the neurons in your brain. The limitations of current available treatments are that there is exactly no cure for Alzheimer's. There is very limited effectiveness and temporary benefits. Also, the medications can have many side effects also. The cost of treatments in these medications is usually very high, and usually the diagnoses are done on a later stage when clear symptoms are visible. Yoga can be used as a supportive and complementary therapy and helps in improving the overall well being for the patients of Alzheimer's. The benefits of yoga are it helps to improve blood flow to the brain, reduces stress, enhances cognitive function is experienced. It helps to improve the mood, promotes better sleep, improves balance and mobility, and encourages mindfulness. For the yoga therapy, a mix of pranayam, yoga nidra, asanas, sitting in nature, omkar, meditation if possible, depending on the stage of the patient, and shavasana. These practices would give all the benefits of the yoga to the patient, and also asanas done can be done very slowly and easy asanas, because usually the Alzheimer's patients are 65 years plus. So anything that benefits them, like Rekha Gati, which can be slow and mild, and also other easy asanas can be done with the help of a wall and the therapist support.